this study, we compared the Plume effect of two popular aesthetic devices. Here on the left side of the screen, you can see the Erbium YAG 2940 resurfacing laser by Cyton, and on the right side of the screen, you can see the Morpheus 8 fractional radiofrequency device by InMode. We know that plume effects can be hazardous in terms of being carcinogenic or mutagenic, and can also transmit biologic materials such as viruses and bacteria. Particularly in the COVID-19 pandemic environment, we must be very wary of the particles potentially released during this plume effect to ensure the safety of practitioners as well as patients. This is a commercial-grade particle analyzer. Here we are measuring the ambient treatment room environment, and you can see the average particles per second is approximately 8. We can read the particles per second in the environment, as well as the size of the particles down to a 0.3 micron sensitivity. This allows us to identify the number of particles per second being emitted by the plume, and also the characteristics of these particles. This is an adjustable depth fractional radiofrequency device called the Morpheus 8 by InMode. It contains 24 coated needle tips that can treat patients at anywhere from 0.5 millimeters of depth to 4 millimeters of depth. We treated patients with both the resurfacing mode, which is 0.5 millimeters, as well as a 1 millimeter depth, and measured the air environment surrounding this device. Here you can see our recordings during the treatment, demonstrating that particle size is within range of normal ambient treatment baseline particle size. This is the Erbium YAG 2940 nanometer laser made by Cyton. This is a popular aesthetic device for resurfacing of the face. The particle reader is consistent with this visual plume effect, demonstrating nearly a 4 times greater particle per second recording, as well as larger particle sizes. Our study shows that the Erbium YAG resurfacing laser has a 4 times higher plume effect than fractional radiofrequency.